Good afternoon. I'm Maliki Weekland, Project Facilitator for a global technical consultation on folate status in women and neural tube defect risk reduction. This consultation is supported by the Micronutrient Forum. I'm joined here today by Ken Brown of the Bill and Melinda Gates Foundation, Lynn Bailey from the University of Georgia and co-chair for the consultation, and Lorenzo Bato of the University of Utah, also co-chair of the consultation. Thank you all for joining this afternoon.
Thank you.
I wanted to talk a little bit and take this opportunity to get your perspectives on the work of the expert committee that's been convened today in Ottawa to discuss some of the issues around folate status in women and neural tube defect risk reduction. Ken, can you share a little bit about the provenance as to how this consultation came to be?
Well, I was approached in my role as program officer at the foundation to understand why the foundation isn't currently doing more for the control of neural tube defects in children. And my first response to that question was to look at the literature to understand what is the magnitude of the problem that we might be addressing, and discovered that there wasn't a clear consensus around the size of the problem. Although there is good information on how best to control the deficiency, we weren't sure where best to intervene and to what extent we needed to intervene. So we had requested the Micronutrient Forum to explore with experts in the field those particular sets of issues so that we would know how to move ahead to control this problem.
Thank you. Lynn, building off of what Ken has said, can you speak a little bit about why folic acid, why now?
Certainly. Folate is a vitamin that's required for cell division, so embryonic development is dependent on this vitamin. And this means that during the rapidly dividing cell period when the spinal cord and brain is developing, there needs to be sufficient folate for normal development. And one of the most important public health discoveries actually of this century is that this vitamin, if it's taken before a woman knows that she's pregnant and during that very, very early stage of embryonic development, that a very, very large percentage of neural tube defects, a very major birth defect impacting the development of the spine and the brain, that these neural tube defects can be prevented with this vitamin. And we have the evidence that it works from research studies, and we have the evidence that it works in developed countries. What we don't have now is a plan to implement this in vulnerable populations in low and middle income countries.
Thank you. Obviously, there's a lot of expertise that's needed to tackle these issues and to help progress this work. Lorenzo, can you talk a little bit about the team that's been assembled, the committee that's been assembled, the global experts and the different areas of expertise that are represented?
Yes, I mean, as Lynn has stated, the scientific issue seems to be fairly simple, but actually being able to deliver an effective intervention, particularly in low and middle income countries, requires a whole host of expertise. You need to have the biochemical expertise, the clinical expertise, but also you need to understand how to deliver these intervention in a simple and inexpensive way. So the team, I think, has done a great job in assembling experts. We have experts in the biochemistry of this issue. We've got clinical experts. We've got experts that are able to see this from a global and international perspective. We've got epidemiologists, we've got experts in international health, we've got nutritionists. I think if this is going to be successful, which I think it will be particularly because of the composition of this committee.
Thank you. And Lynn, Lynn, can you share a little bit about what some of the shared objectives are of the committee members and the approach that the committee is taking?
So some of the shared objectives is to really understand how to assess risk. For example, how do we assess risk based on folate status? And we focused on the WHO guidelines, looking at red blood cell folate concentration, for example, and looking at a threshold to guide us in assessing risk for neural tube defects. So how do you implement this guideline, though, in the most vulnerable populations? And then how do you also couple it with data related to NTD prevalence? And so our goal, or this roadmap that we're developing, is to get to the ideal situation that we can assess risk, we can develop an implementation plan that will be sustainable, and then we can observe our ultimate goal, and that is to reduce or eliminate folic acid sensitive neural tube defects.
Okay. Ken or Lorenzo, do you have any other items to add about the approach, the objectives, and the shared values of the committee members?
I would support entirely what Lynn had said, and again, I think one additional or a complementary objective of our work is really to provide sort of a general framework to this, which we hope would be a global action. One of the issues that we face in our day-to-day work internationally is that perhaps this issue has not had the visibility that, in the opinion of many, would have. So we hope that this would be one step in that important direction.
So we've convened the committee this week in Ottawa. We've had a robust couple of days of discussion here and deliberations. I'd like to get from each of you your first impressions of the work so far and what we've talked about over the course of the last 2 days. Ken?
Well, first of all, I think the Micronutrient Forum has done a fantastic job in assembling experts that cover the different areas of expertise that we've described. And each of these individuals has voluntarily agreed to contribute time and knowledge to the process. So that's fantastic. There has been very lively discussion and interest and enthusiasm expressed by the group to tackle this set of problems. And I think as we continue our deliberations, my hope is that we have a clear set of conclusions with regard to what the next steps will be. And I think that will take 2 or 3 levels of activity. One is re-examining available information on the magnitude of the problem. 2 will be identifying opportunities for intervention, both at the global level to support programs and, importantly, at the national level. We know that fortification is probably the best approach to reach women during those critical early days of pregnancy, before, in many cases, they even know they're pregnant. And the challenge then is to find adequate, appropriate vehicles for fortification and proceed through the steps of implementing those programs and assuring that they work successfully. I think our group is on that path to identify what are the specific activities that have to be accomplished to achieve that set of outcomes.
Thank you. Lynn?
I've been excited and energized by the interdisciplinary approach to addressing this very complex question, and that is to have an intervention plan that can be implemented in middle and low income countries, because we know folic acid can reduce neural tube defects. This is a proven scientific fact. But to bring together the experts to develop a plan so we can address this issue in vulnerable populations is very exciting. And it will take, again, this continued interdisciplinary approach to put the roadmap together, to identify, and I think that's really what we have done in this committee meeting, is to identify what those gaps are. And then the next steps, how do we fill those gaps to move us forward to our ultimate goal?
Thank you.
I would only add that apart from being an exciting couple of days, I think one of the pieces that add value to these deliberation is an effort to try and bring together strands of intervention that historically have been fairly separate. For example, I think what came out is that we need a system that is able to systematically look at the burden of disease that's mainly hidden in many countries. At the same time, we need a system that provides ongoing and systematic monitoring of the risk factor profile. I mean, what needs to happen in terms of intervention related to folate and other risk factors. These historically have been going on parallel tracks instead of being integrated. And the third is that we need to have a better handle not only on the number of people who are born with these conditions, but also what it means for them over time and for their families and for the healthcare system. I think this group is taking a hard look as to how to do that in an effective, integrated, and also cost-efficient manner.
Thank you. I think you've all highlighted and underscored the importance of this work and the challenges ahead. As just a final closing note, I want to thank each of you for your guidance and leadership through this process. I'm excited about the work that's been done and looking forward to what's coming. Thank you.
Thank you.
Thank you.